Hi everyone, I'm Dr. Bita. I work at Center for New Medicine and Cancer Center for Healing. Today I would like to talk about the correlation of oxygen and cancer. Cancer usually likes low oxygen environment and acidic environment. And we know when the body is acidic, you're not oxygenating that well. That's why an optimal or a good health or good body means you want to have an alkaline body. You don't change your urine pH, you don't change your blood pH necessarily. It's the extracellular fluid, it's the urine pH that's alternates. It becomes acidic or alkaline, depending on your lifestyle and diet and stress. They're all key factors. And when the body is acidic due to stress or animal product and less green product or green produce, green juicing and vegetables and all that, then the body becomes acidic, and that's a good environment for cancer. So when the cancer environment is low oxygen, they produce hypoxia activating factors. Oh no, hypoxia intrinsic factors, so HIF. And what that means is that cascade then will produce, activates other protein, other growth factor that can make the tumor grow even more, like VEGF, vascular endothelial growth factor. So sometimes when patients have cancer, when I do the VEGF marker, it tend to be high. So that means it is a low oxygen environment. And also cancer doesn't like to have, sometimes tumors, when they grow big enough, then they don't have much blood supply to them. So they are kind of like an anaerobic environment. But then they become chemo and radiation resistant, because now when they give you chemo into your bloodstream, it doesn't reach the tumor to shrink it. So one thing that we do, I recommend my patient that goes through chemo or radiation to do hyperbaric oxygen. Hyperbaric oxygen chamber is excellent because it increases the blood flow, it increases the oxygen to the tumor, it helps the chemo reach to the tumor. It makes the cancer more sensitive to that chemo that you're getting from your oncologist, or even radiation. When you do get radiation with hyperbaric oxygen, it makes it more sensitive to the radiation. So it's important to do these stuff or other therapies, like we have nanobath or other therapies that can help your body get oxygenated. The best one is hyperbaric oxygen chamber to do when your body is going through chemo and radiation. Except there are a few chemos like doxorubicin you don't want to do hyperbaric oxygen with. So that usually people who are at the hyperbaric, they do have that knowledge to ask you what chemo you're on and what chemo is contraindicated. There's not that many, but adriamycin, which is doxorubicin, is one of them. Another way of increasing the blood flow and oxygenating the body is, for example, hyperthermia or infrared sauna. Infrared sauna will increase the blood flow. It can help the body oxygenate. But I like hyperthermia in people going through chemo or radiation. There are some doctors in Santa Monica or even at our office that we do hyperthermia with the chemo, because hyperthermia will increase the blood flow to that area. That means it helps with the oxygenation. So that way the chemo can reach to the cancer area more easily. It makes it more chemosensitive. And also if patient going through radiation, they could do hyperthermia to that area, to the tumor. It's a local. Unfortunately, we don't have full body hyperthermia in here, but in Europe, they do have full body, which is beneficial. Makes the patient more chemosensitive or radiation sensitive. And infrared sauna, which helps the body increase the blood circulation and makes sure that helps you to get rid of the toxins, helps the body get oxygenated as well. So going back to the oxygen, another way is exercising. When you exercise, cardio, not weightlifting, because weightlifting is anaerobic exercise. When you do about cardio 20 minutes a day, 5 times a week, that's beneficial. It helps your body become oxygenated. So that's another simple way. So simple ways is with your diet, with your exercise, and then also sometimes trace mineral, magnesium can help the body become alkaline. And then in terms of low oxygen, how do we know how our body is? Do I have a cancer environment in me? Do I have low oxygen? There is a blood test that I do on my patient. It's called fasting PHI. It stands for phosphohexoisomerase. And that shows the cancer environment. So when the PHI start climbing up, that means that's a good environment for the cancer. And patient, then metastasis can happen. They're at higher risk of metastasis. Or if they're doing therapies, but the PHI is still going up, that means they're not responding to the therapy they're at. It needs to be changed. Majority of time, PHI is a good factor, is a good monitoring blood work. But sometimes, very few though, few percentage of patient PHI may be normal, even in a stage 4 cancer. But that percentage is low. So majority of time when patients have active metastasis, PHI spikes up. Or the environment in someone's body who don't even have cancer, the PHI can be high. That means their body have a cancer environment. So that means they have to change the diet, increase their oxygenation in the body. I hope that little talk was helpful. Thank you for joining me today.